All right, y'all. Welcome into today's lecture, chapter 11 on burns. So, a couple of things to go over. As y'all will remember, along with this video, you'll have to complete the attendance quiz for this chapter. It'll be titled Attendance Quiz for today's date, October 27th. There will only be two questions. The first question will be what you learned about this from this chapter per se, and the second question will be what the password is, and I will say that sometime during the lecture today. But all this is so you can get attendance credit for today, even though we're not having class in person, just to make sure that you guys are actually watching the video. Hopefully this will work well like last time, uploading it to YouTube. If you have any issues with it, send me a message. If I don't get to it right away, I will probably get to it on Friday. I'm traveling with the soccer team to their conference tournament, and yeah. Anyway, Friday we don't have any games, so it'd be easier for me to see it. Okay, so to get right into it, also a quick note, if you need to pause this lecture, I'm not going to pause and wait as if you guys are taking notes, because that's dumb. So if you need to stop and take some notes, pause it, continue on as needed. Alrighty, let's jump right into it. Okay, so burns can occur in every age group and in really any setting. The thing that determines the amount of damage that occurs is how intense the heat is on the skin and how long that skin or your body is in contact with that heat. It also the thickness of the skin will also determine how severe it is. So places like the bottoms of your feet, the palms of your hands that have calluses and thicker skin, the damage may not be as severe as other places that have thinner skin, like your groin, like your face, your head, those kinds of places that have thinner skin. And just a little bit of depth upon that as well. The reason that the tissues die from a burn is because the heat becomes so severe that your body can't dispel it. And so those cells die. Okay. We have different types of burns, burn classifications. So this is a quiz question, these next few slides, these classifications, these types of burns. So put a star by them. The first type is a thermal burn. This is caused by things like flames, hot objects, vapors that are flammable, like from a spray can. If it catches fire, and also things like steam and hot water, those are thermal burns caused by things that are hot. Next, we have chemical burns. These are caused by different types of chemicals that cause a chemical reaction on your skin. These are not great. There's all sorts of different chemicals that can do these types of things. Typically, they're acids, highly acidic or highly alkalytic compounds. If any of you will remember, there's like the acid alkaline scale, right? Water is pretty close to neutral, whereas things like lemon juice and those things are acids, whereas milk is a little bit alkaline, and there's other things that are further on the other scale. But those things that are on the extremes can cause chemical burns on your skin. Last, we have electrical burns. Most typically it's caused by contact with an electrical current, but how bad the injury is depends on several things, including the type of current, which is like alternating current, like the electricity that's in your house. You also have direct current that comes from different things, like Certain types of generators run direct current. There's actually athletic training treatments that we use sometimes that use direct current. One of those is called iontophoresis. The Basically the difference is the direction in which the electricity runs. So just to give you like a quick illustration, so alternating current or AC, sometimes you'll see it on like generators or on like your power box on your house and those kinds of things. Alternating current, electricity always runs from positive to negative. An alternating current that will alternate on and off. So ultimately, the electricity will run both directions. Whereas with direct current, electricity only goes one direction, from positive to negative, always. So that doesn't, so that's not going to change, right? Like where the positive end, right? The positive end of the circuit and the negative end of the circuit doesn't change. In alternating current, the circuits actually switch sides back and forth. Okay. Direct current is actually more prone to cause damage. So with athletic training treatments, like we're more careful with direct current than anything else, because it's much easier to burn somebody with direct current. So with iontophoresis, which we actually don't use very much in the athletic training setting, but I used it a lot in the physical therapy setting. You use it to like drive medication through the skin, because that electricity flows in one direction, it's able to help push that medication through the skin. But if you're not careful, it's really easy to burn somebody. So the type of current is really important. The voltage or like the intensity of the electricity also plays a role in that, as well as how big of an area gets exposed to the electricity and how long it's on, just like everything else, basically. Okay, so we talked about the classifications of burns. Now we're going to talk about evaluating how bad a burn is. Okay, so there's three severities of burns. The first being first degree, the second being second degree, and the third being third degree. So really the only difference is how deep into the skin it gets. So a first degree burn, which is superficial, like a sunburn, is a first degree burn. Okay, that means it's only penetrating that very top layer of skin. A second degree burn penetrates multiple layers of skin, but not all layers of skin. Okay. Second degree burns often have blisters. So a sunburn can also be a second degree burn if it gets deep enough, if it's severe enough. And then a third degree burn penetrates all the layers of skin and can even penetrate into underlying tissues. So that is really what determines these different types of severity or the different depths of a burn. Okay, that is also a quiz question. Put a star by it. Okay. So one way that we evaluate thermal burns is by what's called TBSA, or total body surface area of the burn, like how much of the body it actually covers. So there is this thing called the rule of nines. Okay, so basically what it's saying is the arms is each worth 9% of your total body surface area. So if one arm is completely burned, that means 9% of your total body surface area, the total surface area of your entire body, has been burned. And then you can kind of add it together, like if you have both arms, then it's 18%, right? If you have the whole front of your body, that's 18%. If you have the whole back of your body, that's 18%. Your head is 9%. Your face is 9%. Back of your head is 9%. So on and so forth. With adults, it's really easy because everything is pretty proportionate. Children and infants, it's different because not everything is proportionate, right? Like kids' heads are bigger than their bodies a lot of times, right? It's just not quite proportionate like an adult. But that's one way they keep track of the amount of surface area that gets covered by burns. Another way to evaluate it and determine the surface area is by the 1% rule, or the rule of the hand. So the size of your hand is about 1% of your total body surface area. So if you take your hand and put it over where the burn is, however many hands you can do over the surface of the burn, you get 1% for each hand, if that makes sense. Anyway, just a really good way to evaluate things. Good information for first responders when they arrive in the hospital, to help them know what they're dealing with. Okay. The next thing you have to evaluate is which parts of the body are burned. So like I talked about earlier, places where the skin is the thinnest is where it's the most dangerous and the most deadly, per se, right? The most harmful, and the most debilitating. So burns on the face, the hands, the feet, and the genitals are most severe. So we talked about the hands and the feet have thicker skin. Well, they also get used the most, right? So if the surface of your hand gets burned, that's really debilitating, right? Like if you can't even use your hand. Same with your feet. If the bottom of your feet get burned, really hard to walk. Okay, so even though the amount of damage might not be as severe, the amount of how debilitating it is are makes it difficult. Okay, circumferential burns are basically burns that cover the entirety of an extremity, right? So it goes all the way around your arm. Okay, whereas non-circumferential burns are mainly just like spot burns. Okay. So next, when evaluating a thermal burn, we also want to determine if there's any sort of respiratory involvement. So you can get the air, the heated air into your airway just by breathing it in, and it can actually cause your airway to swell, which is obviously deadly, like we talked about with anaphylaxis and anaphylactic shock. So you need to be careful with somebody who has been exposed to really high levels of heat, especially in like an enclosed space, like in a building, those kinds of things, because they could have inhaled some of that superheated air, and it can cause damage to their airway. Now, they'd likely be able to feel it, so it's not like it would be like a huge surprise. Like they would probably feel a lot of pain in their airway, and you'd be able to tell first responders that when they take care of them. But it's definitely something to keep an eye on because it can happen in anywhere from 2 to 24 hours, right? So it can take a minute to cause that kind of swelling, but it is very dangerous. So the next thing you have to determine is if there's other injuries as well, right? So if somebody's in a burning building, right, like there's a chance that something fell on them, those kinds of things. So you have to be able to evaluate other injuries in conjunction with burns. If they have a pre-existing medical condition, that can really affect their recovery from burns and can really change the way you treat a burn. People that are older than 55 years and younger than 5 years, it can be especially dangerous for them, mainly because people that are older than 55 years old often have other health issues that can really complicate treatment, um, like things like blood flow, like if they have diminished blood flow to an area, and if a lot of tissue has been damaged, the ability of that tissue to regenerate is severely diminished, and so it can be difficult. The recovery can be much more difficult. And as far as children under 5 years, the biggest problem is their reaction time and their reflexes are not very good. So if you'll notice, like in adults, when we touch something hot, like we let go immediately. Whereas with children and infants, that their nervous system isn't developed to the point to where it registers nearly as quick. And so often they'll like hold on longer or stay there longer, and it will cause increased damage. So it's kind of an interesting deal. But that is something definitely to keep in mind. Oh, now this is kind of like a little decision tree to look over. Take some time to look at it, to be able to evaluate it. We've talked about it several times, like first aid, athletic training, medicine in general. A lot of it is just like a decision tree, right? Like if this is true, then I should do this. If this is true, then I should do this. Those kinds of things. Okay. Now we're going to look into some other signs of first degree burns, of different degrees of burns. Excuse me. So for first degree burns, the things you need to look for: redness, mild swelling. It'll be really tender to the touch, but it will also just hurt. Okay. Anybody who's had a sunburn, which I would assume is most of us, understand what this feels like. Okay. Um, yeah. So as far as treating superficial burns, you need to apply cold water or a cold compress, which is like um, taking a rag with cold water, a gauze pad with cold water, and cover that burn with that. Takes some of the heat out of it, and can really be pain relieving. Okay, ibuprofen is good as an anti-inflammatory, can help relieve a lot of the pain and discomfort. Elevating that arm or leg to help drain swelling is helpful. Having them drink water. Literally, when you get burnt, you're dehydrating those tissues, and so making sure that you're drinking water to rehydrate those tissues is important for the regeneration and the healing of the area. You can also apply aloe vera and other lotions. Um, you need to be careful early on. Aloe vera is very soothing and very helpful. Some other lotions that are, especially ones that are thick, kind of like Vaseline and those kinds of things, early on when the burning is still really active, it can actually trap in that heat and can cause more pain and more damage to the tissues. So the lotions to rehydrate the tissues are more helpful a little later on, where if you'll stick to those things like aloe vera that are more soothing early on, that can be very helpful to prevent further damage. Now to second degree burns. So some things to look for. The biggest difference really is blisters. And if it's bad enough to um, really cause significant damage to the skin, like the skin is opening, you're getting some bad peeling, those kinds of things often are signs of a second degree burn. Um, you'll often have fluid discharge. It will be more painful than a normal sunburn would be, right? Than a first degree burn. Um, you're really going to do those first three things that you would do for a first degree burn, but you're also going to want to apply some antibacterial ointment and keep it clean, right? Because we're opening up the skin and exposing the body to possible toxins or infection. So you need to be careful with that. And burns are very, very, very susceptible to getting infected. So you have to be very careful. And this is where we talked about, so last time when I talked about bandaging wounds and I talked about using those non-adhesive dressings, these are helpful for burns because that tissue with the drainage, with the blisters, those kinds of things, if you get dressings that stick to the skin, when you have to clean it, can become really painful. So making sure you're using non-stick dressings is important. So when you have a large second degree burn, when it's covering a very large area, those first three steps are the same. So if we go back a couple slides, oh, it's not going to let me. Never mind. So using those first three steps, like applying the cold water and compressing, ibuprofen or an anti-inflammatory is really good, and then elevating the area to prevent swelling. Also, I mean, the cold compress, right? Like exposing that area to cold ice water, those things is really helpful. Um, if you're covering a large area with ice water or doing like an ice bath or something, you need to also be careful for hypothermia, right? That very quick transition to cold from hot can really put the body into some shock. So you have to be careful not to overdo it, and that you're monitoring them for signs of hypothermia. For those really large burns, you also need to call 911. If it's serious enough that it's covering large areas, that is something that needs to be seen by further medical care, so they can help take care of them. Now for third degree burns. So often for these really full thickness burns, the skin can be really, really dry, leathery, even charred, especially for those thermal burns. Um, it just goes black, right? Like everybody's seen when fire turns things black. It's kind of the same deal. Um, the biggest thing is this person needs to be seen by a medical provider. So we need to do what we can to protect it, to make sure that it's not going to get things in it. Cover it, keep it clean, and then we just need to send them to appropriate medical care. As far as cleaning out the wound, you're not really going to do a whole lot of that initially, unless you're going to, be out in the weather or you're out in the mountains, those kinds of things. As long as you have access to pretty timely medical care, you're not really going to do those things. You're just going to take them to get seen, because these are not good, and they need to get a little deeper medical care than what we can provide as first aid providers. Okay, so some later care for thermal burns. Okay, first of all, you need to listen to the physician and what they tell you to do. That's first and foremost. A few other suggestions: make sure that you're doing everything to stay clean when you're changing the dressings. Like I talked about before, these wounds are very, very susceptible to infection, so we need to do everything to combat that. Okay, if they have any unbroken blisters, do not pop them. Just leave it. Don't drain them. Okay, leave them intact. Next, you need to change those dressings daily, like I talked about. When you leave things bandaged for too long, it can be a breeding ground for infection, so you need to change them frequently to keep them clean. Obviously, like I mentioned before, watch closely for signs of infection. Then elevate it for the first 24 hours to prevent some of that severe swelling, and then give anti-inflammatories, Tylenol, ibuprofen, those kinds of things if necessary. Okay, now we're going to talk about chemical burns. Like I talked about earlier, chemical burns come from some sort of chemical that is very acidic or alkalytic, that reacts with the skin and causes a burn. Now, one thing to keep in mind is as long as those chemicals are in contact with the skin, they'll continue to burn. So it's important to remove that chemical as quickly and easily as possible, without hurting yourself. So chemicals can come in two different forms. So these chemicals, they can be dry, like a powder, or they can also be in a liquid form. So it's important that when you're doing this, you also protect yourself. If you're dealing with a dry chemical, you need to have a respirator on so you're not breathing it in if you're brushing it off. And liquid, you need to make sure that you have PPE on, gloves, some sort of a barrier to protect yourself from also being exposed to that chemical. Okay. If there is a safety data sheet, it will be connected to the chemical itself. So if the container that the chemical was in is available, read that. It will have recommendations if it's to come in contact with somebody's skin. Okay. So a couple of things to look for when you're looking at chemical burns. It will be painful. Obviously, it will feel like a burn. It can also cause some breathing difficulty. And the fumes that are caused by these chemicals can also be very painful to your eyes or cause some difficulty with vision. So it's also important that you're making sure to take the steps to protect yourself. Eye protection, Like I talked about, a respirator or a strong mask to protect your airways and your eyes. So as far as how to take care of them, kind of like I talked about, we need to get that chemical off the skin. So if it's a dry chemical, brush it off. You don't really want to use water right away. Often these dry chemicals are activated by water, so brush it off the best you can first, then use some water to get it off. If it is a liquid, then you're going to want to flush that burn with a lot of water for at least 20 minutes. Most of the time, like labs and those kinds of places that are using these types of chemicals will have a shower, a chemical shower, to clean that person off. But you need to do it at least for 20 minutes or until EMS arrives. And you obviously need to call 911 for these chemical burns. Okay. Another thing, if you do get a chemical in an eye, you're going to have to flush out that eye. The way to do it is to tip the person's head so that the eye that is affected is facing down, not facing down, but it's closest to the ground. So you're not going to put the affected eye above your other eye, because when you flush it with water, that water is just going to run into your other eye and hurt your other eye. So put that on the bottom, flush it with warm water from the side of your nose, so the top side of the eye, down the side of the face for at least 20 minutes. You're going to flush that like crazy to try and get that out of there. Yeah. Okay. Last but not least, electrical burns. So there's three types of electrical burns. There's thermal burns caused by something catching fire from electricity. There's an arc burn, which is just like a really quick flash, a shock. Or there's a true electrical injury, which is direct contact with this electricity, right? Like touching a wire that you're not supposed to touch. Not getting too close to something and it reaches out and shocks you, right? That would be an arc. So put a star by this because this is a quiz question. It's also a question on the final, okay? So true electrical injuries are the only electrical burns that have both an entrance and an exit wound, okay? That means there was enough electricity in contact with the body that it went in and came out, which means it creates two wounds and also damages everything in between. So it's a very serious injury, but that is also a question on the final. So make sure that you understand that. Okay. If you have any questions, please reach out. A true electrical injury, this one right here, let's make it clear, is the only one of these three that has an entrance and an exit wound. Great. So, if you come in contact with an outdoor power line, if there's a downed power line around, okay, here's some things you need to do. You need to make sure that the area is safe. Don't go into the area until that power is off. Like we talked about early in the semester, there's no reason creating two injured people, right? Two people that have to go to the hospital. It's just going to cause more problems. So you cannot help somebody until they are in a situation where you are not going to hurt yourself and debilitate yourself. Make sure that we're doing those things that we would always do, right? Check their breathing. If they're unconscious, check how responsive they are, right? See if they're breathing, see if they have a pulse. Cover all their burn wounds with a sterile dressing. Keep them clean until they can get more help. And then you need to make sure that they receive professional medical care. This is really, really, really high amounts of electricity and can be severely damaging to your body. Not even just on the outside, but to the way your body works, right? Like nerves and very important organs, including your heart, run off electricity. And when these amounts of electricity come in contact with the body, can also cause organs and things to run haywire. Okay. Now, a little tip. If you come around an area of a downed power line and you start to feel tingling in your feet, that means that electricity is strong enough that you are in an area where you could get shocked. So the way to protect yourself is to lift up one foot and hop on one foot until you are out of that area and you can no longer feel that. The reason this is important is because electricity works in circuits, right? In circles. So electricity doesn't just go from point A to point B, right? Electricity has to go in a circle. Okay. So if you eliminate one of these tracks by picking up one of your feet, then the electricity will not go through you. Okay. So it's like with your house, like everything works in circuits. So if something quits, if something's not working, that's because there's a break in that circuit somewhere, right? So like on your house where you have circuit breakers, all that is a barrier so that if there is some sort of an electrical problem, that circuit breaker turns off and it breaks the circuit, breaks the circle, and doesn't allow the electricity to keep flowing so that it doesn't cause damage to your house, to your appliances, to the people in the house. Okay. So by lifting up one foot, you're breaking the circuit and not allowing that electricity to trap. It won't go into your body because it has no way to escape. Okay. Next, if there is some sort of electrical contact inside of a building, okay, you need to turn off the electricity, find the circuit breaker, the electrical box, and turn it off. Okay. If it's an appliance, unplug it. And turn off the electricity circuit breaker, okay? And then do not touch the appliance or the person until you know that current is off, okay? Just to protect yourself. That's why you do it twofold. You unplug it and you also are turning off the electricity in the home, right? Inside the building, okay? Now, one thing to keep in mind. So when somebody gets a third-degree burn, okay, a true contact injury, that means there's an entrance wound like this, and there's an exit wound, okay? So this exit wound is larger than the entrance wound, okay? You need to keep in mind that between that entrance wound and the exit wound, all of this tissue is going to be damaged. It's not just this little tiny point where the electricity goes in, or even this big part of skin out here. It's everything in between is damaged. And so that may also be a big factor into what's going on with that person. So a couple of things to look for with electrical burns. Look for the actual wound. It may not be very big, but look for it. Look for also an exit wound. Look for if there was a place that the electricity came out. Check for multiple burns. And then, of course, check for breathing and a pulse. Okay. Last but not least, if they are not breathing, they don't have a pulse, call 911. Make sure that, if there was other things involved, that you're checking for broken bones, checking for other injuries. Treat that person for shock if it caused damage to other parts of their body, interruptions in blood flow, those things. And then make sure you're keeping all of the wounds clean to prevent infection. Okay, thanks for listening. So the password for this lecture is going to be Happy Halloween with a capital H on happy and a capital H on Halloween. Thank you guys for tuning in. Make sure that you get your attendance quiz done. You'll have a week to complete the attendance quiz. You'll only have till Tuesday to complete the quiz. So make sure that you're getting it done, getting it taken care of, so that you're not losing points. If you have any questions, feel free to send me an email, send me a message on Canvas. Also, I did want to mention, if you don't get a response from me on Canvas, I do kind of struggle checking my inbox sometimes. Send me an email, send me a text, okay? Especially if it's something urgent, if it's about whether we have class or not, whatever. Find a way to contact me. I will definitely answer texts, and I usually will answer emails pretty quickly, okay? Thanks, guys. Have a great weekend, and we'll talk to you later.